So I'm going to go straight into sort of introducing today. Some of you will already know the drill and have been with us at some coffee mornings before, but if you haven't, please do go grab yourself a tea or a coffee. We are aware that it's really sunny and beautiful today, so you might want to grab, I don't know, a juice or a water or something instead of coffee. That's totally fine. But thanks for joining us on our virtual coffee morning. So today we're lucky, we're so lucky. We've been joined by 4 speakers today, and we're going to be focusing our virtual coffee morning on diabetes type 2 awareness. As always, I just have to make you aware I have to do a little bit of housekeeping. So the first one is that this meeting is being recorded, just so that we can upload it to YouTube and our website. As you know, it is sunny, so some people probably are out in the garden, so if they can't capture it now, then they can capture it later on our sites. If you're not comfortable with being recorded, just turn off your video and then you can just still listen and watch yourself. Everyone is muted. It just helps us be able to hear when the speakers are talking. But at the end, when we do our Q&A, of course, feel comfortable to unmute yourself and ask your question directly to our experts. You can also post comments, questions and feedback via our chat facility on the Zoom. And please remember, you have the opportunity to ask questions later. So, you can post them and ask. We really encourage people to ask questions. So please feel free. We do, however, say, please don't post any links or images, as we obviously can't monitor whether those are safe. So if you do post any links or images, you may be removed from our meeting. And just a reminder that we are active on social media. So you can follow us at ARCC Limited, and that's on Twitter, Facebook, Instagram, and YouTube. And then finally, just before I get into our introduction, one of our speakers today is actually going to be guiding us through some really useful, practical tips. So if you have a chance now, please grab yourself a tape measure if you have one. Don't worry if you don't, just watch and you'll learn anyway. But if you want to grab a tape measure and have a go while we're doing it, then please use this opportunity now to go grab one. So Maman, are you able to share the agenda for me? And I'll just go through that with everyone. Brilliant. So yeah, I'll just quickly do a very, very brief introduction. And then we're going to be hearing from 4 experts. So we're going to be joined by Aya. She's our first speaker, and she's actually speaking all the way from Japan today. So we're really lucky. Then we're joined by Professor Jackie Sturt. And then we've got Linda Graham, who's here from Croydon. And we're also joined by research fellow Rita Forbes. So we've got some amazing speakers. They will all get proper introductions as well. Then we'll have our Q&A, which is where you get your opportunity to ask whatever you need to ask. And then, of course, our mini raffles, which we do on all our virtual coffee mornings, a chance for you to win like a little coffee hamper, because obviously normally we'd be face-to-face and you might have coffee and teas with us. So this is sort of kind of like you're experiencing it. And then at the end, I will just tell you about our next upcoming events. So the reason we are doing this Zoom today is that unfortunately there are quite a lot of people that do live with diabetes in the UK. About 3.9 million people are living with diabetes in the UK, and that's more than 1 in 16 people in the UK. That's the estimate, because obviously we're assuming diagnosed or undiagnosed. There are 2 types of diabetes, type 1 and type 2. And type 2 diabetes is the one that's more common. And around 90% of the adults who have diabetes will have diabetes type 2. So the main reason I'm just doing a quick introduction is just because obviously we're based in Croydon. So I'm just going to let you know that there is a lot of healthcare support in Croydon, and I'm sure Linda will be able to tell you even more detail around that. But just to let you know that if you ever have any concerns, or if you are pre-diabetic or you have recently been diagnosed, then your GP and nurse in Croydon will arrange to see you at least every year, and they will perform simple tests just to make sure that you're staying fit and healthy. These tests are basically just to check your blood for glucose. Some will also check for cholesterol, and they're going to assess how well your kidneys are working. They should also just make sure that they're running a basic foot check and eye screening as well. So they're just for you to keep in the back of your mind, like, am I getting all of these checks? If you do need specialist support, then that will be your GP that you would need to talk to, as they would refer you to the Croydon Community Diabetes Service. And that's where you'd benefit from more advice from sort of diabetes specialist nurses or consultants. And there are loads of other resources available, like education courses for people who are newly diagnosed. There's access to dietitians, you get access to therapists who may assist you to adjust with your long-term condition. And of course, if you do develop more complex foot problems, as an example, then you would be referred to the Croydon Local Podiatry Service. The Croydon Diabetes team does support adults and young people from the age of 19 upwards who have type 1 or type 2 diabetes. And that's like, clinical advice, education. But it's really useful to know that it's also support for you, but also your partner and your family, or if you have a carer. And you will get access to the diabetes specialist nurses, dietitians and consultants. And they all work together. So it's a really good service here in Croydon. And then Naeem, can you just share my email in the chat? Because I'm just going to let everyone know as well that if anyone on this call does have a long-term health condition, doesn't have to necessarily be diabetes, but of course, if you do, you're welcome. Just to let you know that in Croydon, we do run our Expert Patients Programme, which is a free 6-week course for anyone with long-term conditions. And we also run a long-term conditions programme that's more one-to-one support, where you get assigned a health champion for sort of anywhere between 1 to 8 sessions. That's personal care for you. So if you do want to know any more about that, then please just email me at the email that Naeem will put in the chat. I would say more, but because we are so lucky to be joined by 4 speakers today, I'm going to leave it at that and introduce our first speaker. So we are really lucky to be joined by Aya Temple. She's a researcher from the diabetes team, which is led by Professor Jackie Sturt from King's College London. So Aya, are you able to talk for 10 minutes about type 2 diabetes risk factors and complications? So yeah, as I said at the beginning, Aya is joining us all the way from Japan. So thank you so much. So let me just bring up your screen and just call out to me when you want me to move to the next slide.
Yeah. Hi, thank you very much. Hi everyone. My name is Aya. I'm a researcher from King's College London. And I'm going to talk about general information about diabetes and risk factors and some of the symptoms and complications. Next, please. So this is the slide about your body and the pancreas. And I put pancreas because pancreas is a very important organ when you talk about diabetes. Because pancreas produces a hormone called insulin. And insulin is an important hormone to convert your sugar, starches, and other food into energy needed to your daily life. But if you have diabetes, your body does not produce enough insulin, or insulin doesn't work properly, so that your sugar level in your body increases. Now, please imagine if the insulin is a key and your body cells has got keyholes. Now, either your body doesn't produce enough keys, or the key is a bit rusty so that the key doesn't work properly. So that is the kind of image as happening inside your body. Next, please. So Lizzie already talked about those informations, but so quickly a reminder, there are mainly 2 types of diabetes. There's one called type 1 diabetes and another called type 2 diabetes. The type 1 diabetes, when you have type 1 diabetes, you have to treat with insulin because type 1 diabetes, you don't produce insulin at all, so you have to inject insulin. Well, if you have type 2 diabetes, normally you will be treated by medication or diet and physical exercise. Some people have to inject insulin, but it's not always necessary. Next, please. So I'm going to talk about type 2 diabetes today, and these are risk factors. And first of all, it's age. So I put one risk factors here. It's 40 years old for white people. And I like to ask some, sorry. So then for, sorry. I wanted to ask someone if you can answer the risk factors for South Asian and Black people, but you can go next. Thank you. So that's 40 for white people, but only 25 for Black and Asian people. May I ask someone if you can think of other risk factors? Can we have some volunteers? No? Okay, you can go next. So as well as the age, and you have family history of diabetes or being overweight, and being overweight we measure with BMI. So BMI you can calculate quite easily. It's equal your weight kilogram divided by square of your height in meters. And also having a large waist measurement is one of the risk factors, and I'm going to show you how to measure next. And also circulation problems and high blood pressure is the risk factors. And next, please. So I'd like to show you how to measure the waist circumference. And sorry, next, please. So first of all, you have to find your bottom of your rib cage. I'm not sure you can see. So rib cage is here. I find it's quite easy to find it if you bend slightly slightly side by, and you can touch your rib cage quite properly. And the next one, you have to find your hip bone. So hip bone is relatively easy. It's a bone sticking out in the bottom, and you need to measure the midway between two. So you put your tape measure. And it's very important that the line of the tape measure is horizontal to the floor. And be relaxed. And you breathe in your inhale and slightly exhale. And that you can give you the measurement. Thank you. You can go back to the slide. Thank you. So the healthy waist circumference is different for individuals. So 80 centimeters for all women and 94 centimeters for most of the men, but 90 centimeters for South Asian men. So this is a link from Diabetes UK about how to measure your waist circumference. So if you have time, please look at this one. It's got very well made and very easy to do. Next, please. So those diabetes symptoms, again, I wanted to ask some of the symptoms if you might know. Is it possible someone can join and then guess some of the diabetes symptoms?
I'm glad you asked this because this comes up all the time, but like,
okay.
True, there aren't really many symptoms, or like people often tell me that like as a sort of thing, like, oh, how can you know this? You can't really tell, etc.
Oh, right.
But I'm not sure if that's true or not. It's just that that's what people always tell me.
Okay. Great. Shall we go to the answers then?
Yeah, and also people are putting the answers in the chat.
Okay. I don't know how to see the chat, but
that's all right.
Would you be able to read it?
Yeah. So Grace has put thirst. Needing to go to the toilet a lot, headaches. Bina's put tired. Sandra's put frequent urination, and Jade's put blurred vision ?
Brilliant. Okay, it's actually probably all of them was already appeared. Okay, could you go next, please? And is it symptom appears? Yes, you're all right. Just go first, going to do all the time, extreme tiredness and weight loss and blurred vision. Yes, all those are symptoms of diabetes. And it's very important to know that the more risk factors you have, when you have diabetes, so type 2 diabetes, actually, when you have symptoms, it's quite gradually develops your symptoms. So sometimes people don't really notice those are symptoms, because some people think that, oh, I'm just getting old or I'm just overworked. So especially for tiredness, that's easily missed. It's very important to know those are all some of the symptoms. And those are diabetes complications. And I'd like to ask again, people, if you know some complications, please. Can we have any answers, Lizzie?
I'm just giving a bit of time for people to write in the chat.
Sure. But I can now read it. Yes.
You can. Oh,
yes,
good.
Great.
Good.
Yeah, great.
So
Organ
Grace
failure,
said,
lovely. Yes. Great.
Is that for organ failure? Is that any organ?
Yes, it's about renal problems. Is quite common for diabetes, and some people go into dialysis. Yes, kidney problems. Yes, great. Yes. Okay. Next, please. Yes, I put all the complications here. And also have some gum diseases as well. And it's relatively unknown, and eye problems, and heart attack and stroke is also complications. And I only put physical complications here, but diabetes can also affect your mental health, and that will be talked about by Professor Sturt today. Yes, next please. Thank you. But the good news is an early diagnosis and good control type 2 diabetes and then blood glucose level can reduce the risk of developing these complications. So if you notice any symptoms, please do go to the GPs and ask for the test. And normally GP can give you the test, and if they refuse, then you can have a test at Lloyd's Pharmacy. It costs £10, but you can have test. So those are contacts from Diabetes UK, and there's a big charity dealing with diabetes. So if you have any concern about diabetes, please do contact them as also. And I'd like to finish my talk with my husband's personal experience, because my husband had diabetes. So my husband was diagnosed when he was 20 years old, and he's white Caucasian, and he's very skinny. But he noticed that some of the symptoms he needed to go study all the time. So he went to the GP and asked for the test, but he was refused because he didn't have any risk factors at all. But he persuaded the GPs to get a test, and he had diabetes. So that's telling you that even though you don't have any risk factors, you can still develop diabetes. So please do goes to GP if you have any symptoms, of your family and friends. If you have any symptoms, please ask them to go to GP, because earlier diagnosis is the key to treat diabetes. Thank you very much.
Brilliant. Thank you so much. And I know it's late evening over there, so even more appreciate you coming on today and just giving us, sort of that information around, risk factors, complications, etc. So thank you. And I will move on to our next speaker. So we've got Professor Jackie Sturt joining us today, and she's a professor of behavioural medicine in nursing. She currently works at King's College London from Warwick Medical School, which is where she worked from 1998 to 2012. She's a behavioural scientist, and for much of her academic career, she's worked with diabetes. And her work involves the development and evaluation of complex educational and psychological interventions to support diabetes self-management. Jackie co-leads the Clinical Diabetes Research Group and is I'm not sure what the PL stands for, of the LYNC project, investigating the use of digital clinical communications by NHS clinicians and young people with long-term conditions. Her research impact activities are focused on supporting NHS specialist long-term condition clinicians who are adding email, text and Skype to their armoury of patient consulting tools and undertaking field trials in primary care of the DOSA diabetes structured education programme for South Asians with type 2 diabetes. Jackie teaches across faculty undergraduate and postgraduate programmes on motivational interviewing, public and patient engagement in research methods and long-term conditions of self-management. So obviously a very expert speaker. So thank you for joining us, Jackie. And are you able to speak for 10 minutes on diabetes and emotional health?
Yes, certainly. Thank you, Lizzie. So, I mean, it's really great to be here this morning and have emotional health in diabetes kind of, you know, right up there on your agenda. As you will have kind of picked up from Aya's talk, there's a lot to think about in diabetes. There's a lot to manage. There's a lot to get your head around, and all of that does have its emotional consequences. And yeah, I did, as Lizzie, with that great introduction. Thank you for that, Lizzie. I did spend a lot of my earlier career working in trying to help support self-management. And there are some barriers to people from managing their condition, their diabetes, with sort of good levels of knowledge and good levels of confidence and good levels of skill. And a significant barrier to being able to kind of meet the demands of the condition are emotional in nature, because you know, it's quite easy with diabetes to kind of become overwhelmed by it. So this is the topic I want to talk about today. I want to introduce you to a topic and a name of something that we call diabetes distress. So if you want to just share my screen now, please, Lizzie or my mum, and I'll tell you a little bit more about diabetes distress. And the first thing to say is that diabetes distress is normal. So anyone that's having to live with a demanding and progressive long-term condition like diabetes is going to feel the strains of that emotionally and the burden of it. You know, there's medications to take, there's blood glucose levels to keep track of, there's appointments to make, to keep and to make. There's foot checks, you know, you've got the diabetes appointments with your GP and your practice nurse, but then there's foot checks to make, and there's eye checks to go for, and there's cholesterol levels to keep an eye on, and then there's diet and physical activity to kind of think about, am I doing enough and am I eating the right sorts of food? So the management of all of this, just living with diabetes, is going to, for most people, at some point lead to diabetes distress. And the thing to, you know, kind of my take-home knowledge about this, if you live with diabetes or you know someone close to you who lives with diabetes, is it's absolutely normal. We as health professionals expect people to worry about living with diabetes. We expect them to have concerns, fears, and think about the threats associated with the condition. And it's really important that you tell your health team if you're feeling these anxieties and these worries and these concerns, because we know we can do something about it. And the most important thing we can do about it is say, yeah, I understand. And you are not alone. Most people feel like this some of the time, or some of the year, in fact, when they're living with their diabetes. And that's the most important thing we can do to help you. When we know that when your diabetes distress is raised, you know, it's kind of you're feeling more overwhelmed than maybe you did last month or last year, then we know that impacts on your ability to sort of concentrate on your diabetes and do the things that your healthcare team would like you to do. It impacts on whether or not you can remember to take your medications on time, you know, whether you can just fit in that time to make an appointment to go and have your eyes tested, your retinopathy screening, you know, whether or not you can go along for that blood test to look at what your blood glucose level is, and face up to the findings when you get those results as well. It impacts on all of that. So we really want to help you with diabetes distress and to lower your distress, because by lowering it, we know that that it will then help you to feel more confident about managing the condition. So I just want to give you a sense of some of the questions that we would be asking you as clinicians if we're trying to understand, you know, how much of a problem diabetes distress is for you at the moment. So just think about a 0 to 4 scale, just, you know, the tape measure that you've got in front of you. Find the 0 and find the 4. And that's your scale I'm going to ask you to measure your diabetes distress on with these questions. So the 0 means something's not a problem. And the 4, which is the maximum, means it's the most serious problem. And everything in between, you know, 1 is a minor problem, 2 is a moderate problem, 3 is somewhat serious problem. So just think of that 0 to 4 scale about yourself. If you have diabetes, or if you don't have diabetes and you know someone that does, think about them and what you think they might be, how you think they might answer this question. So the first question is, feeling scared when you think about living with diabetes. So would you be scoring a 0, a 1, a 2, or you are put the, you know, this is a more bigger problem for you. When you think about diabetes, how, you know, what are your fears? You know, how big are your fears? Are they great? So it's a 3 or a 4, or are they quite low and it's a 0 or a 1? So just jot that down if you've got your phone or a piece of paper and a pen near you, or just try and kind of remember it. And thanks, Lizzie. Lizzie's putting some data into the chat already, which is great. So the second question is, feeling of deprivation regarding food and meals. So how big of a problem is that for you? Is that a 4 because it kind of weighs on your mind, or it's no, I'm okay, I don't feel deprived, I'm doing fine? The third question is feeling overwhelmed by your diabetes. Again, is this something that you just think, oh, there's all these things to do this month and I just don't think I can manage to juggle all that. So I'm just not going to do any of it, or I can just manage to do that one thing, which is what I think is the most important. Like, I'll just take my pill because I just can't think about going to appointments and having blood tests. Feeling alone with your diabetes. So this is a really interesting one. You know, you might be surrounded by people with diabetes, but are you talking to other people about it? Are you talking to your family about how you feel? Are they talking to you about how you feel? Do you know other people with diabetes, but nobody's talking about how they're coping with it? So feeling alone with your diabetes, how big an issue is that for you on that 0 to 4 scale? And lastly, worrying about the future and the possibility of serious complications. How much does that prey on your mind? So these are the questions, or these are a sample of questions that we would ask you if you came to a consultation with me and I was your diabetes nurse or your practice nurse. These are questions I might ask you. And if you're answering if most of your answers are 3 to 4, then your diabetes distress is really quite elevated. And I would really be wanting to focus in on talking to you and exploring some of those answers that are in the 3 and the 4 range. If your answers are, around 2, then I think it's what we call in healthcare watchful waiting. We want to just be keeping an eye, maybe asking you those questions again in 6 months' time at your next review to see whether you're on an upward trajectory or a downward trajectory with your diabetes distress. And if it's a 0 to a 1, then it looks like at the moment you're coping really great. You know, that's great. Let's keep talking about your emotions though, because these numbers can change. So so that's what diabetes distress is about, and those are the sorts of questions that we would be asking you. So can you put my next slides up again, please, just to run through a little bit of information, just to see how common it is. So great, the next slide, please. So the diabetes distress is similarly common, you know, in terms of how many people have it in people with type 1 and type 2 diabetes. So in this slide here, you can see that people with type 1 diabetes, it's about 1 in 4 people will have it. You know, if you're sitting in a waiting room and there's 20 people in that waiting room with diabetes, then 5 of you are going to be experiencing high diabetes distress. And if you look at, if you screen everybody in a whole GP population with diabetes, or a whole diabetes clinic across a year, over 50% of people at some point in that year will have high diabetes distress. And if you ask those people again about 12 months later, over 70% will still have high diabetes distress. So it doesn't go away on its own. And this is in people with type 1. The data on type 2, if you put the next slide up, is not very different. It's pretty much the same. Slightly, it's 1 in 5 people with type 2 diabetes distress will have those higher levels. So in your clinic of 20 people in the waiting room, there'll be 4 people in there that'll have high distress. And we know it's a third higher in women, in people who are experiencing diabetes complications such as eye problems, or if they've got foot problems or some heart disease, the diabetes distress will be higher. And people who are taking insulin for their type 2 diabetes also are more likely to, because their treatment burden has just ramped up another level. So they're likely to have diabetes distress. So if you are, changing medication, then do be aware of how you're feeling about it, and talk to your healthcare professionals to help you just to voice it and say, actually, this is getting me down at the moment, and I just need to say this out loud. And you'll be surprised at how much impact that can have. So I just want to, last couple of minutes, show you some resources that can help you if you have diabetes distress. So I'll have the next slide, please. Diabetes UK have produced, and I was part of a team that helped to produce it, a very detailed and extensive guide for healthcare professionals about emotional health in diabetes. And most of it, is aimed at healthcare professionals and how healthcare professionals can help their patients with type 2 diabetes, well, with type 1 and type 2 diabetes, and the emotional health needs. But one part of that guide we've got a whole set of information leaflets for people with diabetes. And if you want to find these, it's free to everyone. It's just on the Diabetes UK website. You can see that the link in the bottom of that slide, and hopefully maybe Lizzie or my mum can post it in the chat for you. It will take you to these leaflets for people with diabetes. So you can read this, and this is about what I'm feeling like this. I've answered 3 or 4 for some of these questions that I've just been asked. What can I do to help myself? And this leaflet, this one here that we're looking at is about diabetes distress, and will give you a sense of what you can do. Now, there are some, I haven't mentioned the other emotional health impacts there are for people living with type 1 and type 2 diabetes. And there are some others, and they're less common, but they can be problematic, and they are common enough that healthcare professionals need to know about them, and people living with diabetes need some help in order to manage them. So the first one is just adjusting to a diagnosis. It changes the you. So there's a leaflet on that. You can go back to on the link that on the previous slide, you can click on that and it will bring you all these leaflets. So if you're thinking, so at the bottom left there, if you're thinking, actually, it's been suggested that I should move on to insulin, but I'm terrified of taking insulin. And there's a leaflet for you about that. You can, thank you, move on to the next slide again. You can see there's eating problems with diabetes. These are all known emotional health issues related to living with type 2 diabetes. Fear of hypos, depression, anxiety, worried about insulin and injections. And there's, like the adjusting to life, there's a general one about peer support, and that's another all encompassing leaflet that can give you some information about why it's important to get peer support for you living with diabetes, and how it can really help you to live well with it, cope with it, overcome some of those emotional obstacles that you might find, and ask for help, importantly, when you need it. So that's a whistle-stop tour of diabetes and emotional health, and very happy to talk more. And thank you so much for putting your numbers in the chat. I'll have a look at them whilst you're listening to the next speaker, and really happy to talk about some of those later in the Q&A session. So thank you very much.
Brilliant. Thank you, Jackie. Thank you so much. We have already got some questions in the chat, so I'll just let everyone know that we have noticed them, so please don't think we're ignoring them, and we'll address them at the Q&A at the end. And I've also just put that really useful link that Jackie was speaking about, where you can get those resources on emotional health and your diabetes. So it's just that link's in the chat right now. So we'll move on to our next speaker. So we've got our own local Croydon, Linda Graham. Linda's been brilliant, and she's a team leader for the Surrey Physio Link Workers and the Link Worker for GP SuperNet PCN. Linda, thank you for joining us today. We'd love for you to speak for 10 minutes on dietary support for diabetes, especially speaking from your Link Worker role. Thank you.
Hi everybody, I hope you can hear me okay, so thumbs up if you can hear me. Brilliant. Okay, let me explain my role in Croydon. I am a link worker, so we are a very new role to the NHS. We started 2019. Our main job is to assist the clinical team. So the clinical team will look after your clinical health. That will be everything related to the health condition and the medication that you might need. My job, and it's a beautiful job, is to support people for their social needs related to health and anything else that might be affecting you at this time. So I work out of 6 surgeries in Croydon, and I am the team leader for all the Surrey Physio Link Workers. There are a total of about 10 of us now in different parts of Croydon and in different boroughs. So like I said, our job, and it's more of a, it's not a job, it's a vocation that we do this, is to ask people what matters right now. So what matters to you? You might be struggling with a health condition, you might be newly diagnosed, you might have other things that are really on your mind relating to your health condition. Now we're talking diabetes today. I'm coming from a point of pre-diabetes and also coming from a point of cardiovascular disease, because they're also very strongly linked. My job is to sit down with people for a good hour to find out what matters. What do you need? What is your concern? Very similar to what Jackie has mentioned, okay? Talking about where are we at? What do you need to help you move forward? What's the worry? What's the concern? And my job is to help you signpost to some of those services that could help you. Or this is very close to my heart, as becoming a pre-diabetic in COVID. So I became pre-diabetic during the first lockdown, which was a massive shock to me. And then I started to seek out what support was available, from being a human struggling with being pre-diabetic, and also what was on offer. What can help me change or prevent, and that's a huge word that I think we need to sort of continue to think about, prevent this turning into full-blown diabetes, and for me to help other people. So I've worked on the Desmond programme, the national programme. I've worked on the Walking Away from Diabetes programme, and they're all wonderful programmes. But sometimes, if I'm really honest, if you're in a community space, you want to stay in your community space and you want to be able to access where you live your diabetes support. And I'm also coming from a lifestyle support. So I'm not a trained nutritionist, but I've been working with other humans for a good 30 years and have many different skill sets. So my main skill set is exercise prevention. So I am very much involved in using movement to support a health condition. So exercise and the power of movement changes everything within our physical structure. It supports diabetes, it supports how we develop as humans. It supports blood pressure, supports cardiovascular disease, because we know with diabetes, there are other long-term health conditions associated with diabetes. So from a nutrition point of view, I look at and support people and have conversations with my people in my groups, and I'll tell you about the groups in a moment, about the best way forward to help maintain the health condition, to prevent progress of the health condition, and to actually try and reverse the condition, because I'm a strong believer in food as medicine. Food can be very good medicine, as well as the clinical medicine. So they all work so strongly hand to hand. So I am reading a book, and have been reading it since January, since becoming a pre-diabetic. This book, it's probably back to front. It's a book by Dr. Gemma Newman, okay? And this is Plant-Based Foods, The Power to Change Health with Plants. Just eating vegetables, it's not complicated. Eating vegetables, changing the way we eat, less processed food, more water, more movement, improving insulin sensitivity, lowering blood pressure, reducing weight. Now, we know from myself gaining a stone in the first lockdown, we know that weight gain has a significant effect on our health, okay? So by losing weight, eating better, living better, will change how our body reacts to the health condition. Movement, for me, like I said, is like a medicine. Doesn't mean you go for a run. It doesn't mean you have to join a gym. It means about planning your week, planning your day, adding movement into your day, into your plan, to support the health condition, the diabetes, or the prevention of the diabetes becoming full blown, okay? Movement powers your muscles. So anything is better than doing nothing at all. And yes, then there will be the barriers. I don't have enough time. I can't do this. I can't do that. And that's where I come in, and my team. And we come in and we say, let's talk about the barriers, very similar to what Jackie said. Let's talk about what's stopping you moving forward. Shall we make small goals? My job is to support those small goals and looking if they are they the right type of ones? Are they realistic? Do they suit your lifestyle? Because this is also about supporting families. So lots of people that I speak to are women and men who are supporting loved ones with diabetes. And that's really hard going, because you're existing with the condition in the whole family. So it's about having the confidence to speak to someone about it, because I'm going to throw a question out there. I wonder how many people see their diabetic nurse on a regular basis for support. I'm just not sure. And I wondered if the people on the chat could give me that answer, because we need a plan. We need a plan to live, because if we don't have a plan, we are just thinking, well, we could try this and we could try this. There's so much information. Becoming a pre-diabetic, I saw all of the information out there and I was blown away. So I decided to tap into one group, which was a support group in my local area, linking in with my doctor's surgery. I got onto the national programme, but it was too far for me to go. It was too far for me to work and get into the national programme. That's the honest truth. And so I linked into my surgery, what they were offering, my own knowledge and peer support, very similar to what Jackie said again. So lots of support from creating and trying to find it. I had to investigate. It was a personal experiment. So I think the key things are, because I have no idea what the time is, the key things are food diaries. What are we eating? Why are we eating it? Is it emotional? Is it because I'm bored? Is it because I've got too much housework? Is it because I'm stressed out because I have this health condition? Is it that? So we've done the food plan, meal plan, fewer and cutting out processed food. It's not natural. It's given to us by companies and they're making money. And this is just my own opinion. Okay, natural is better. It's cheaper. It can be quite enjoyable if you do the right way of cooking it. It's about investigating, experimenting with yourself, because we want to change this prognosis. We want to change what has happened. We can change it, we can live with it. With the right support, we can do that. So in my area of Croydon, I'm based Woodside area, we've set up we have a community group. We have a pop-in group where we have lots of people coming with diabetes and other health conditions, where we come, we talk, and we support each other. We have a cup of tea, we do some exercise. Some people don't want to do it, but I encourage them because sitting down is not good for health. We do a bit of dancing with music, and we also deliver a regular exercise group. Now, it's exercise, but it's more focused on movement to improve your cardiovascular system, and along with really good food, shift a little bit of weight. Because most of us, the percentage of us, are probably holding a little bit of extra weight and can't manage what the lady, Miss Temple, showed us about the waist measurement. That would probably be quite shocking to some people. And to get down to that measurement is quite hard work. So it's about putting in place how you can do it. What's the plan? What's the prevention plan to move you forward? So that's what I'm doing in Croydon. It sounds a bit whistle-stop Tory. Lots of water, good food, processed food moves away, dairy moves away, low fat, good plant-based. I'll give you the name again of the book. It's just a very small part of the book. It's very interesting about how we can live better with our health condition. I'm trying to think if there's anything else I've done. Whole foods, plants, just mindful eating. And if there's a reason, it's most of us eat probably for the wrong reason. We're not hungry. We're eating because we're in Tesco's, or we're eating because our families come, or we're eating because we eat. We are a nation of become eaters. Let's have a look at that. So that's what I'm doing within Croydon. So if anybody wants to get in contact, I'm sure my email will go up, and I will let you know where I am, what I'm doing, and how I'm doing it. So I hope that helps.
Thank you, Linda. I was actually just about to ask, am I allowed to share your email?
You are? Yes.
Brilliant. So I will do that just in a second into the chat, just so everyone knows where to look. And thank you, Linda. And I think a couple of people have already said that they would be interested in joining your group. So if they are interested, is it just a case of them emailing you?
Perfect. Yep. Okay. Email me and then we can have a chat.
Okay, brilliant. Thank you, Linda. So we've got one speaker left, and then we will go into our Q&A, so that lots of really important questions have come up on the chat. So we will attempt to answer those with our experts. So next we've got Rita Ford. Rita Forbes is a research fellow and a member of the clinical research in diabetes team within the division of care for long-term conditions. She's also a general nurse and a midwife, and she has an honorary clinical post at St. Thomas's Hospital in London. Rita was awarded a doctoral fellowship from the Foundation of European Nurses in Diabetes and joined King's College London as a PhD student in 2013. Prior to this, she worked clinically at the Diabetes Centre Mater Hospital in Dublin, and was also the inaugural advanced nurse practitioner in diabetes nursing in Ireland. So another brilliant speaker with a wealth of knowledge. So thank you, Rita. And are you happy to speak for the next 10 minutes specifically about diabetes and pregnancy?
Thank you very much. And I just want to clarify, actually, my surname is Ford, which is...
Oh, sorry, did I say Forb?
Yeah, that's absolutely fine. It's just a little ironic that my line manager's surname is Forbes. So yeah, but I think you have my correct email address and stuff like that. So if you want to share my presentation, and I'm just going to speak to you this just for the next 10 minutes, just in relation to diabetes and pregnancy. And I know many of you might think, oh gosh, that's not relevant for me, or that's not something I'm interested in now. But just some of the information that I share today, whilst it may not be relevant for you at this particular point in time, it might be relevant for somebody you know, or it might become relevant for people over the course of time. So if you want to go to the next slide, please. And just over the next 10 minutes, I'm just going to speak to you about why we need to think about diabetes and pregnancy, what's involved for people, how we're doing with it, or how we can do with it. And actually, my final point is, and why that may be, and that's just a little hint about how we're doing with diabetes in pregnancy. So if we go to the next slide, and I'll share with you the most important point that you can take away from today's meeting, from my part of today's meeting. And if you want to just activate that slide, please, is that diabetes care before pregnancy is important for the mom and for the baby. So if this isn't relevant for you, anybody that you meet that could potentially become pregnant that's living with any form of diabetes, just let them know that diabetes care before they become pregnant is really important, both for themselves and for their future baby, and they need to speak to somebody about it. So encourage anybody you know that is living with diabetes, if they're sexually active and if they're of reproductive age, that they need to bring up the topic of pregnancy with their healthcare providers. Even if it's not something that they're actively thinking about now, they need to start these conversations. So if we can go to the next slide, please. And I'm just going to tell you why it's important. And it's important because we do know that for women living with diabetes and any form of diabetes, they have higher risks in terms of pregnancy outcomes compared to women without diabetes. Now, I suppose it's important to say here at this stage that most women who become pregnant living with diabetes go on to have perfectly healthy and normal pregnancies and babies. However, living with diabetes does increase the risks that things may not work out so well. And for most of these people, these risks are preventable, they're modifiable. So with a little care before people become pregnant, before they stop contraception, we can help to improve the outcomes both to themselves and to their babies. So if we can go to the next slide, please. And there's just a few things to think about here. So in relation to diabetes and pregnancy, some of the important things we need to think about are blood sugar levels. So for diabetes and pregnancy and people considering pregnancy, we would support women in relation to planning pregnancy to have lower blood glucose levels than we would expect outside of pregnancy. So it is important because we do know that high blood sugar levels can interfere with the way the baby develops. And this can interfere with the way the baby develops before most people realize they're pregnant. Excuse me. So after somebody conceives, they're really not going to know they've conceived for 4 to 6 weeks. And during that period of time, if the mom has high blood sugar levels, it can impact the way the baby develops. So care before pregnancy really is targeting blood sugar levels predominantly at a time when the mom won't know she's pregnant. So if somebody has stopped contraception and they haven't identified that they've become pregnant yet, during that window of time, the baby is developing. So the mom's blood sugar levels can impact the way the baby's development during that stage. So if you can activate the slide again, please. One of the things we also need to think about are medications during this time. And most medications are absolutely fine. However, we do know that some of the medications for pregnancy aren't particularly safe. So again, it's important for people living with type 2 diabetes in particular, because people with type 2 diabetes might be on medications that are prescribed for the management of their type 2 diabetes that we really wouldn't recommend during that early stage of pregnancy. So it is important. In addition, for people with diabetes, regardless of what form of diabetes they have, if they're considering pregnancy, we would encourage that they're on a higher dose of folic acid that you can get over the counter. So women will need to they will need to get a prescription for a high dose folic acid from their GPs. And it's a 5 milligram dose of folic acid. And most of the folic acid that's available over the counter would be 0.4 milligrams. So we're taking over 20 times the dose. We're recommending over 20 times the dose of folic acid for women once they have a diagnosis of diabetes. And this is really important. And also we've got to think about some of the other medications we might prescribe in relation to blood pressure or cholesterol that we particularly wouldn't want women to be on during those early weeks of pregnancy. So pre-pregnancy care and care before before pregnancy is about making sure that we change all of the medications to suitable alternatives, because there are suitable alternatives. So if we can help women to engage with their doctors and nurses, and if we can help doctors and nurses to engage with women living with type 2 diabetes before pregnancy, we can make these changes in a safe way. Now, the other things I'll just go through, so if you want to just go through the next one, it's about other conditions that people might be living with, such as high blood pressure when they have type 2 diabetes, or their kidney function. We just want to make sure that everything is in the best possible condition prior to pregnancy. Also eye screening, and I'm sure many people are aware the importance of eye screening and annual eye screening. So if somebody is considering pregnancy with type 2 diabetes, we would just make sure that they've attended their eye screening, and also to let the screeners know that they're considering pregnancy, because this would be really important. And the eye screeners will be looking for specific things in relation to pregnancy and early pregnancy changes that can occur due to somebody living with diabetes. And this is both the effect of pregnancy on their diabetes, but also they will want to look to see if they're the big changes. We also need to think about the effect of diabetes on pregnancy. And then Aya has spoken a little while ago about, our previous speakers just spoken about weight. And for anybody, whether or not they have diabetes, if somebody is overweight going into a pregnancy, that brings additional risk factors. If somebody has diabetes and they're overweight going into a pregnancy, that can just increase the risks that things might not go ideally according to plan. So just the next, please. So the next one is just in relation to screening again, eye screening and kidney screening, just to make sure that the mom is in the best possible health before she becomes pregnant. And one of the, I suppose, aspects that we speak about in relation to pregnancy that people sometimes, might just often kind of raise a question about is contraception. For women living with diabetes, we would encourage that if they're of reproductive age, so if they have the potential, so women are still having periods, if they're sexually active, they should either be actively trying to become pregnant or actively trying to prevent a pregnancy. And when we say actively trying to prevent a pregnancy, we're talking about using a reliable form of contraception. So it is important that people would engage with their healthcare professionals to use reliable forms of contraceptions. On their own, we do know that things like condoms and the withdrawal methods are not reliable. So it is important, if somebody has type 2 diabetes, that they're using a reliable form of contraception, or otherwise they need to start thinking about, are they actively trying to become pregnant? So we're trying to eliminate or trying to reduce the risk of people just taking a chance. So if we can go to the next slide, please. So in a sense, all of these images kind of, I suppose, epitomize what pre-pregnancy care is for people, for women living with diabetes, for all forms of diabetes. And in particular for type 2 diabetes, we need to think about the medications that we as healthcare providers are prescribing. So if we don't know somebody is thinking about pregnancy or pregnancy as a potential, we may prescribe something that we would choose not to do had we known. And if we can go to the next slide, please. So how are we doing? So we know what to do. We know what's involved in pre-pregnancy care, but actually we're not doing that great. We do know, as a nation in the UK, only 1 in 12 of all pregnancies is planned in accordance with the NICE guidance. Now, what the NICE guidance are, so these would be the national guidance, is that we would aim for women's HbA1c, so that's their overall blood glucose control, to be less than 48 or less than 6.5%. So 48 is the number we would use now before they become pregnant. We would aim for women to be taking folic acid for 3 months, a high dose folic acid, 5 milligrams, for at least 3 months before they become pregnant. And we would aim that women would not be taking any medication that we do know are harmful around the early pregnancy period. so that these medications would be stopped before conception. So when we think of all of the women, so there is a national audit conducted every year in relation to pregnancies in women with established diabetes. And these are some of the markers we look at. And of these three important markers in 2017, so the report for 2017 reported that less than 8% of the women had reached these three markers. What it also showed was that 90% of women with type 2 diabetes did not reach these. So women with type 2 diabetes aren't doing as well as women with type 1 diabetes in relation to the care prior to pregnancy. So we've got to ask ourselves why that is. So what are we doing about this? And that brings us on to the next question. And if we go to the next slide, we can see, so some of the work I have been doing and the work I did for my PhD was trying to understand what are the things that are influencing the fact that women with type 2 diabetes aren't prepared as well as women with type 1 diabetes for pregnancy. And so this is a very high level overview. So there's lots of other things, but this is just some of the things that are really important and some of the things that we're taking forward and looking at in further research. And one of them is in relation to how we identify, as healthcare professionals, how we identify women with type 2 diabetes and how women with type 2 diabetes actually identify themselves as a woman with type 2 diabetes and reproductive potential. And we do know that as healthcare professionals, there is this tendency still to think of women with type 2 diabetes or type 2 diabetes as a condition of older age. We do know now that type 2 diabetes can occur at any age, and we're seeing increasingly younger people with type 2 diabetes, young children and adolescents developing type 2 diabetes. And of the younger people developing type 2 diabetes, so the young children and the adolescents developing type 2 diabetes, girls are more likely to develop it than boys. So we're seeing higher rates of type 2 diabetes in younger girls. And the issue for, I suppose, going forward for all of us is to think about pregnancy and the impact pregnancy can have on diabetes, but importantly, the impact diabetes can have on a pregnancy and the importance of planning for pregnancy. One of the other things we identified is the pathways of care, our health system, how we structure care. And actually, it's inherently biased against young women with type 2 diabetes. So young healthcare professionals and health services aren't designed to actually identify these young women, and they're not designed to, I suppose, encourage or make them aware or increase the awareness of the relationship between type 2 diabetes and pregnancy. So as a result, women with type 2 diabetes are more likely to present to the maternity services pregnant and not realize there's a connection between type 2 diabetes and pregnancy, and that it would have been advisable for them to plan a pregnancy. And the other thing we have learned is about communication, and it's about how we speak to and how we speak with women living with type 2 diabetes and pregnancy. And I'm sure, as many of you are aware and you've heard and you've also picked up from today, that actually it's not easy living with type 2 diabetes. And actually some of the way that it's presented in the media, the way it's presented within healthcare systems can often be stigmatizing. And this can actually challenge the way how women feel freely to speak about their plans for pregnancy. And some of the women I have spoken to in relation to my research, they have shared that actually they don't know how to initiate, they don't know how to start these conversations because they feel stigmatized, and they feel that people look at them when they have type 2 diabetes and consider, well, that pregnancy isn't an option or isn't an issue for them. So some of the work we have done and others have done is about actually taking all of these things in relation to how type 2 diabetes is viewed, how we can manage it within the healthcare system, and how we actually communicate about type 2 diabetes, and working together to try and promote and enhance the uptake of care of women with diabetes. And if you want to go to the next slide, and one of the, I suppose, one of the important findings is that when people are diagnosed with type 2 diabetes, they go to an education program to learn about diabetes. But actually, pregnancy is never mentioned in any of the education programs for type 2 diabetes, or hadn't been. I suppose things are beginning to change, but pregnancy isn't one of those core features. So healthcare professionals don't make the connection if there are young women in the group of the education session that actually they need to address pregnancy, they need to address contraception, they need to address this connection between reproductive health and diabetes. And as a result, women then don't make that connection. So the women don't make the connection between diabetes and pregnancy. So to summarize, and Lizzie very kindly moved on to the next slide, the take-home message for today is really diabetes care before pregnancy is really important for the mom and the baby. You know, make it more visible, make these conversations happen. So if you just want to do one more final click, so before, you know, we can think about pregnancy and whether it's a boy or a girl or the excitement of impending pregnancies, is we need to think about diabetes care. So if this isn't relevant for you right now, it might be relevant to somebody you know. So just share that message. Diabetes care before pregnancy is important, both for mom and for baby. So try and, I suppose we need to get these conversations started. So thank you very much.
Brilliant, thank you. That was so interesting. I think probably for all of us, that was information we hadn't heard before. So thank you, Rita. Thank you so much. And so, yeah, so a lot of you have put questions into the chat already, which is brilliant. So we are going to open up to the Q&A between you guys and our panel of expert speakers. If you have a question that you know that you want someone particular to answer, please just address them. Otherwise, please just say your question, and whoever feels, you know, most confident or happy to answer, they can just jump in. So speakers, you can just stay off mute if you want, and then you can just jump in if you want to. So if you have a question, you can obviously put up your hand, like literally put up your hand on the video if you've got it on. You can also use the raise your hand button function on your Zoom. And then also, of course, you can type into the chat. So I'm just going to make sure that we don't miss anyone from the chat, really. And so I will go to Jay, because he was one of the first people to put in a question, and he's answered a few questions. So do you want to go ahead, Jay, and just ask your question?
Hi, good morning, everyone. Nice to have you on the panel. Lizzie, I have forgotten which question I asked first. Have you got it in front of you?
Yeah, you've asked a few, but the very first one was about glaucoma. Yeah.
I think I have glaucoma. I'm not quite sure 100%, but I have a regular eye screening test at Croydon University Hospital. One of the issues that I want to look at is, and I haven't spoken to anybody about it, is, you know, is there any suggestion on how you manage glaucoma? Because I'm on medication for diabetes, but I just wanted to make sure that before it gets too serious, I can look after myself or manage my health myself.
I think Rita raised her hand, so she can jump in.
Yeah, thanks for the question, Jay. And I suppose the important thing is that diabetes can lead to some specific eye conditions. And whilst there is a relationship between diabetes and glaucoma, it's not the main diabetes related eye condition. Yeah. So for glaucoma, it would be important that your ophthalmologist would check the pressures in your eye. And they often prescribe specific medication. So there's different types of glaucoma. And they use different medication, but the medication is usually drops. Yeah. So and they're prescribed depending on the pressures in your eye and how fast the pressure is increasing. So in relation to having your eyes screened for diabetes, glaucoma isn't specifically one of the things they will automatically check. So you need to check when you're having your eyes tested if they've tested for glaucoma. So it's like a little gust of air that they'll put into your eye. So they'll just squeeze something into your eye and measure the pressure. So it is important that you check that they do that, because not all eye screening services will actually check for glaucoma when they're checking the blood vessels at the back of your eye.
Yeah, thanks, Rita. But the last visit I had I think it was before COVID, so I couldn't do it last year at all. They did check the eye pressure, and it was the clinical medical professional who then suggested the eye drops. So I have been taking the eye drops, but I think I am due for the next one, and I have asked my GP to make it that appointment, because I want to go and check it whether the eye drops have worked or not.
Fantastic. And I suppose that is the important thing, that you always follow up, keep following up. And I think COVID really kind of created that challenge for everybody, particularly with eye screening services were closed. So I suppose that's the important thing, is just to keep following up.
Thank you. Thank you.
Brilliant.
Good luck with this. Thank you.
Yeah.
Thank you. So Anantha, I can see that you've got your hand raised. So
Yes.
Go ahead. You've unmuted, so go ahead.
Oh, okay. Hi. Sorry. Good afternoon, everyone. Just listening to all the experts, it's amazing information received today, and it's great support available as well. It's very comforting thoughts. I don't suffer from diabetes, but my late father and mother suffered onset diabetes type 2, age of 50 onwards. But I'm 50 plus now, so I am concerned, but will I get it? I know it's not genetics, but however, it worries me. So I'm trying to take care of myself by preventing getting the diabetes rather than managing the diabetes like many of you here. It's just prevention. I mean, obviously understand healthy diet, losing weight, and being active, all that prevent getting it. But however, even the thin people with an active lifestyle can get diabetes type 2 too. So how do we prevent getting the diabetes too, really? That's my question. Maybe it's a question where, you may not be able to answer just like that, but just wondered, what else can I do? I was like a pre-diabetic by looking at the glucose level about a few months ago, and reduced my lifestyle and taken less sugar and being more active. Now my blood sugar level come to very normal. So it's so I can do that by self-care and taking all those precautions. But how do I still prevent? Then what else can I need to do to prevent getting it, really?
Go ahead, Jackie.
I'll take the first bit of the question. I'm sure Rita will have, Rita's the clinician amongst us. I'm sure she might have something else to say. I'm sure she will. But just to say that there are strong genetic, considerations in type 2 diabetes. So, even if you do absolutely all the right things in order to reduce your risk, there is still some things you can't change. So if you have a strong genetic predisposition, then, being aware of that as you are is important, because even if you manage to, you're making all the healthy lifestyle choices, and you're, getting your waist circumference, closer to 80 for women, and taking more physical activity and keeping an eye on your blood glucose, then there is still a possibility that you can develop. And so it's being aware of that is really important, because you want to start taking, have the diagnosis at the right time so that you can have treatment at the right time, because it is absolutely possible to live well with type 2 diabetes. And so some things we can change and some things we can't. And it sounds like you're doing a lot of the things that you can change, you're trying really hard at. So that's fabulous.
Thank you.
Yeah, no, I have nothing to add, Jackie. I think that you've said the most important thing. There are some things we don't have control over.
Can I just add something? Hello. I don't know if you can hear me. Hello.
Yeah.
Oh,
yes.
Sorry, just to say, worry. So worry of a health condition, and the anxiety of worry and the long-term effect of worry changes the body's composition. So thinking about what's going to happen in 5 years' time. So we reflect into mindfulness now. Sorry, I've changed rooms. I'm now in a bedroom. Reflecting on mindfulness. So we can't change what will happen possibly even tomorrow. We have to live in the day because of what we've been through. And if you put yourself in a situation of constant what if, it changes how your brain works and how your body works, especially if we think of cardiovascular health and blood pressure and all of these things. So maybe I'm thinking, I can feel signposting coming on here, of mindfulness and anxiety support. So just to tailor off those thoughts of what if, maybe.
That's a really good idea, Linda. Yes. Yeah.
Brilliant. Thank you. And Vida, you've been very patient with your hand up, so please go ahead.
Hello, good afternoon, everyone. Thank you very much for bringing together such a learned team. I really appreciate it. I'm 68 and my dad, as I said, had type 1 diabetes. I have been very mindful, and a lot of the questions I had has been answered now. But I've been so mindful about being careful. And during this period of lockdown, yes, I haven't been exercising because I'm not going to the gym and swimming, but I have done a little bit of exercise, and my has gone up, the glucose reading. So I'm just wondering now, what am I going to eat? Well, even when I make cakes, which I don't make very often anymore because the children are no longer at home, I use less sugar. I use Muscovado sugar, except if it's a sponge, and I don't make many sponges. I do the fresh fruit, I'm eating less of that as well. Don't drink a lot of fruit juices. Don't drink any of those type of Robinson type juices either. Drink a lot of water, and I'm just feeling so lost. But mindfulness will get me there as well. Sort of, that is very helpful. Thank you very much. And I will come to the clinic because I really do wish to continue helping myself, because I have other medical conditions, and I don't want one thing to impact the other, because I can, not worrying about it, but I could see that materializing if I'm not careful.
So are you asking, do you need some more dietary advice around?
Yes, dietary. So it would be a good investment to get the book mentioned, and that will be a start.
I think from what you've said, the most powerful thing you said, Vida, was helping yourself. So you already know, you're already in the mindset of, you know, things are changing, you know, you've done the work. A year at home for all of us has changed our bodies. We are different. We are different. But once you put the wheels in motion, because you've already said everything that you're going to do, you have a plan. You had a plan. Yes. You still have a plan. You're now going to tweak your plan. So you are helping yourself. You've already got it. And then you might need some more clinical support, and then your own empowerment, your own support, and then see where you are. But exactly, mindfulness, make a plan. Let's see where we get to.
My greatest takeaway, I didn't know this at all, is fasting is very good for type 2. So this is something I'm going to really work with you to find out exactly how I should do that in order to benefit from it, because that is perhaps what it'll take at this stage.
Brilliant.
And Vida, I was just going to mention, when you talked about all the things that you weren't eating, you know, that you know from your life with around diabetes, that can you know, lead to high blood glucose levels or rise of blood glucose levels, that they all seem to be what we would call high glycemic index foods. So they're things that take your blood sugars up quickly. Now, you're not eating those. You know, you said the things you weren't eating, like the cakes and the juices and things, you've cut out on. it might be worth, and you'll learn about this if you do look at the fasting diet plan, about the other carbohydrates in your day, those that we see and we talk about as good carbohydrates. The bread, the rice, the pasta, we call them low glycemic index carbohydrates because they release the sugar more slowly and in a more measured way into your bloodstream. But nonetheless, they can result in a rise. They're intended to rise your blood glucose level. That's why we eat them, because we need them sometimes. And it might, so it was just whether or not there are any of those foods, those types of carbohydrates in your diet that you had not sort of thought about.
Yes, I would also make my homemade pasta. I don't even do that anymore. And the other thing I need to be aware of, I've already cut down my portion size because that is also very important. By profession, I was a state registered nurse myself. When I started learning about these things, I even cut sugar out from my drinks. I don't. Since I was 18, I haven't had sugar, and I brought up my children the same, no sugar in their drinks. And I think perhaps I'm just mourning at the moment because I feel I've done all of this and I've sort of still walked head on, but I'm not going to go down. Well, I'll do everything possible not to go down type 1 because my dad had to have injections twice a day, and he also had strict diet, and he had also had glaucoma. So I'm really going to work with myself and with you all, and I'm so grateful. Thank you very much.
Okay. Thank you, Vida. And I was just I know that we're coming up to 12:30, and I know there's lots of questions. But don't worry, diabetes is a really important topic. So we will do more of these events, and they will hopefully, COVID willing, move more and more into the community as well. So you may see us out and about. So Conrad, would you be happy to take to ask our last question, and then we'll just move on to the last bit of our agenda.
Yes, well, I've got type 2 diabetes. I've had it actually for about 15 years, but I think it's mainly my lifestyle, which involves a lot of traveling. So eating all types of food and traveling at different times. But I've tried to control it, and the medication has actually increased. And that's the worrying thing. I've spoken to the doctor, and because the medications got to be so strong now, well, I'm not type 1 as yet, but it's concerning me quite a lot. So I've been looking quite a lot into fasting, and I'd asked a question already about fasting, and I know about the sort of 16:8 or whatever rules, and I've seen other things on YouTube and things of that sort. So together with the fasting, I try to control the way I have my food, and I don't have any bread anymore, white bread. I've stopped taking white bread because I thought that has a big impact. I've changed the type of rice that I eat. I don't have polished rice. I have red rice, which is slightly different. It's got a little husk on it. And as Vida was saying earlier on, I've cut down the portions. So I'm trying to do everything possible, but not getting anywhere. It's how, I don't know how you can tackle type 2 diabetes effectively. And that's something that's a bit difficult, I think, because most of the foods we have, and sometimes whether they're declared or not, there is sugar in it. And I think it was interesting to hear Vida mention about sugars. So there's the two types of sugars I know that, or you can get affected with type 2. One of them is through carbohydrates, and there's a way of going around it that way, but fructose is probably the most dangerous one that you have to worry about. So how do we control, like, say, fructose, and what do we do about carbohydrates? That would be my question.
Thank you, Conrad. Who wants to jump in for that one?
Yeah, I suppose I can just make a comment. And thanks for sharing that, Conrad. And I suppose Jack has put in the chat about Dr. Michael Mosley's book, which will be quite helpful. But also, I suppose, to think about when we're eating foods, it's not just about the carbohydrates, but also to think about the other food sources that you're eating. So things like proteins, having protein in your meal and having some fats. Not all fats are bad. It's about having a mixed meal so that the carbohydrates might not be released as quickly as they would be if they're eaten on their own, so that just your blood sugar won't go as high after a meal as if it would do if you just ate the carbohydrate portion alone. So that's just something to think about. But also, I suppose one of the important things, and we haven't really emphasized it today, is that diabetes is a progressive condition. So sometimes even with the very best efforts and with the best will in the world, what you're doing will change over time because your body's needs change, and sometimes your diet isn't the contributing factor to that. It's just how your body is now reacting or living with diabetes. So I think the important thing to remember is that sometimes it's not always about, things that you can't do or things you haven't been doing or things you could do. Sometimes it's your body is changing, your needs are changing, and that you might need a change in your medication. And for people living with diabetes, that can change. So over time, people might start on, trying to manage just with their diet alone and working very hard on that, and maybe tablets, so oral medication might be included, and then people might require injections, and the injections can be in the form of insulin, or they can be in the form of other medications that are given via injection. So if you're on injections, it doesn't mean that you've changed or converted over to having type 1 diabetes. You still have type 2 diabetes, but you're just needing other medications given by injection, which may or may not be insulin. So when people are working really hard and trying their best, I think it's important that you don't blame yourself that things are changing.
Brilliant. Thank you, Rita. Thank you. So we are going to move over to Naeem, who has very kindly been taking down your names whilst we've been doing this, putting it into a little raffle so that you can win a little coffee hamper, trying to make it as much like as if we were together and we would be sharing our coffee, tea and biscuits with you. So go ahead, Naeem.
Oops, we just ignore this one.
Oh, ignore this one?
Yeah, because I wasn't ready.
No problem.
Okay. Let's find a second. Right. Let's do a shuffle quickly.
Cool. And I'm also going to just put into the chat Naeem's phone number and email, because if you do win, obviously we don't magically know where you live and where to post your coffee hamper. So please do make sure that you either call or email Naeem with your address so that we can post your prize to you.
Yep, that's right. Thank you, Lizzie. Right, let's start spinning the wheel. Let's get the first name. So we've got Andrew as the first person.
Well done, Andrew. So just yeah, drop your address to Naeem and get your little coffee hamper.
Yep. Right, let's do the next one. Right, got Sandra.
Well done, Sandra.
The last person here, they got the final spin. So I guess I'm going to be really bad at pronouncing this name.
Sarakas, I hope.
Sarakas, yeah, there you go.
Brilliant. Oh, well done.
You got Andrew, Sandra, and Sarakas, 3 people. Please contact me by end of next week. And yeah, thank you, Lizzie, for putting that up. Here's my numbers and email. You can contact me and I'll take your address down and we can send them through it. Thank you. Brilliant.
Well done, guys. So just to let you know that obviously we have more events coming up. Our next virtual coffee morning is on Wednesday, the 7th of July, same time, 11 a.m. to 12:30 p.m. And our theme for our next virtual coffee morning is on men's health. So please do let your fathers, sons, brothers, friends know. And of course, women are most welcome as well. And we'll enjoy that session. And then next week, Thursday, the 10th of June, we have a Healthy Homes for All session. I've spoken with Deborah, who is the lady who'll be leading the session, and she's incredible. So please don't miss it, because even if you think you've found the best service providers for all of your utilities, or you think you've got all the best desk device, she literally knows everything and what's on available in Croydon, and she's already saved me money on my water bill, and I didn't think I had a problem. So it's a really, really good way for you to just save some money if you are struggling at all with any utilities or home bills. And then we do still have our weekly dance therapy and community chats. They happen every Monday, 11 a.m. to 12:30 p.m. And they are starting again this Monday coming. Obviously, we had bank holiday this week. Oh my goodness. So we look forward to seeing you all again soon. And of course, just wanted to say a massive, massive thank you to our expert speakers, Rita, Jackie, Aya, and Linda. You guys gave us so much information. I'm literally amazed. So thank you so much. We have recorded this. So if you want to share it with any of your friends, please just forward them the YouTube link. We'll probably put it up at the end of this week, next week. And then finally, if you know anyone that's looking for work, the Asian Resource Centre of Croydon team are hiring. And we're looking for a community facilitator. And the deadline's Tuesday, so next week, Tuesday, the 8th of June. And if you are interested, or you just want to know more details about the community facilitator, you can email any of the team, so me, Mamun, Naeem, Emma, or go on our website or have a little look on our Facebook page. So yes, everyone, thank you so much to our speakers. I think we can all agree that they had amazing information, and we'll see you soon. Enjoy the sun.
Thank you. Thanks for inviting us. Bye-bye.
Thank you so much, Jackie.
Thanks, everybody.
Thank you, Rita.